CEN exam prep discount code. Question 1. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A. Administer 4-labetalol to lower blood pressure. Option B. Administer 4-hydralazine. Option C. Allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D. Administer a nitroprusside drip. The correct answer is option C. Allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 2. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A. I haven't been able to refill my blood pressure medication for a few weeks. Option B. I use cannabidiol, CBD, edibles to help me sleep. Option C. I was diagnosed with Guillain-Barré syndrome as a child. Option D. My grandmother had rheumatic heart disease. The correct answer is option A. I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD use, B, may be important, it is not as critical as uncontrolled hypertension for TIA management. Guillain-Barré, C, can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant. Question 3. Which fracture requires immediate surgical intervention? Option A, clavicle fracture. Option B, open fracture of the tibia. Option C, radial head fracture. Option D, ankle fracture. The correct answer is option B, open fracture of the tibia. Open fractures are surgical emergencies that require immediate 4 antibiotics, tetanus prophylaxis, and surgical debridement to prevent osteomyelitis. Clavicle fractures, A, radial head fractures, C, and ankle fractures, D, are typically managed non-surgically or with delayed surgery. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient is diagnosed with acute appendicitis. The nurse is particularly concerned if the patient reports which symptom. Option A, sudden relief of pain. Option B, nausea and vomiting. Option C, right lower quadrant pain. Option D, rebound tenderness. The correct answer is option A, sudden relief of pain. Sudden relief of pain in a patient with suspected appendicitis may indicate perforation of the appendix. This is a serious complication requiring immediate surgical intervention. Nausea and vomiting, B, right lower quadrant pain, C, and rebound tenderness, D, are all expected findings in appendicitis. Question 5. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A, sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 6. A patient with diabetes presents with a blood glucose of 550 mg/dl, serum osmolality of 320 mosm/kg, and a serum pH of 7.35. What is the most likely diagnosis? Option A, diabetic ketoacidosis, DKA. Option B, hyperosmolar hyperglycemic state, HHS. Option C, hypoglycemia. Option D, lactic acidosis. The correct answer is option B, hyperosmolar hyperglycemic state, HHS. HHS is characterized by severe hyperglycemia, greater than 600 mg/dl, elevated serum osmolality, greater than 320 mosm/kg, and absence of significant ketosis or acidosis, pH greater than 7.3. DKA, A, presents with acidosis, pH 7.3, and ketones. Hypoglycemia, C, presents with low blood glucose. Lactic acidosis, D, has normal glucose. Question 7. A patient presents with acute onset of severe, tearing chest pain radiating to the back. Blood pressure is 160/90 mmHg in the right arm and 110/70 mmHg in the left arm. What is the priority nursing intervention? Option A, administer 4 morphine for pain. Option B, obtain a 12-lead ECG. Option C, administer 4 beta- blockers to reduce heart rate and blood pressure. Option D, prepare for stat CT angiography. The correct answer is option C, administer 4 beta- blockers to reduce heart rate and blood pressure. This patient's presentation, tearing chest pain radiating to the back with unequal blood pressures, is classic for acute aortic dissection. The priority medical intervention is rapid reduction of heart rate and blood pressure to decrease aortic wall stress and prevent propagation of the dissection. Beta- blockers, example esmolol, are the first line agents. While pain management, A, is important, it is secondary to hemodynamic control. ECG, B, is appropriate but does not address the life-threatening process. CT angiography, D, is diagnostic but is performed after stabilization. Question 8. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration-deceleration injury causing shearing forces. The correct answer is option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with a swollen, painful ankle following a fall. The nurse notes that the patient is unable to bear weight. Which test should be performed to guide the need for X-raise? Option A, Ottawa ankle rules. Option B, pivot shift test. Option C, Lockman test. Option D, McMurray's test. The correct answer is option A, Ottawa ankle rules. The Ottawa ankle rules are clinical decision rules to determine whether X-raise are needed for ankle injuries. Inability to bear weight is one criterion that indicates the need for X-raise. Pivot shift, B, and Lockman, C, test the knee for ACL injury. McMurray's test, D, tests for meniscal injury. Question 10. A patient with anorexia nervosa presents with significant electrolyte abnormalities. Which electrolyte finding is most concerning? Option A, hypokalemia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypercalcemia. The correct answer is option A, hypokalemia. Hypokalemia is the most common and concerning electrolyte abnormality in anorexia nervosa, particularly related to purging behaviors. It can lead to cardiac arrhythmias, weakness, and QT prolongation. Hyponatremia, B, can occur but is less common. Hyperkalemia, C, is not typical of anorexia. Hypercalcemia, D, is not associated. Question 11. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, bored like abdomen. Option D, a flatulence. The correct answer is option C, rigid, bored like abdomen. A rigid, bored like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than bored like rigidity. Flatulence, D, is not concerning. Question 12. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A, fetal heart tones. Option B, maternal vital signs. Option C, cervical dilation. Option D, contraction pattern. The correct answer is option B, maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 13. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A, inability to abduct the fingers. Option B, inability to oppose the thumb. Option C, inability to adduct the thumb. Option D, decreased sensation in the small finger. The correct answer is option B, inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 14. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A, administer for pain medication. Option B, obtain a urine sample. Option C, notify the provider immediately. Option D, administer antiemetics. The correct answer is option C, notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 15. Which of the following ECG findings is most consistent with pericarditis? Option A, ST-segment elevation in all leads with reciprocal depression. Option B, diffuse ST-segment elevation with PR-segment depression. Option C, ST-segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 16. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12-lead ECG within 10 minutes. Option B, start 2 large bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A, obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 17. A patient is scheduled for an abdominal CT with oral contrast. Which finding in the patient's history may require special preparation or alternative imaging? Option A, diabetes mellitus. Option B, hypertension. Option C, allergy to shellfish or iodine contrast. Option D, asthma. The correct answer is option C, allergy to shellfish or iodine contrast. Allergy to shellfish or iodine contrast is a concern due to cross-reactivity with 4 contrast agents. Pre-medication with steroids and antihistamines may be needed. Diabetes, A, and hypertension, B, are less significant. Asthma, D, is relevant but less directly impactful. Question 18. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. Delirium tremens, B, presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C, presents with metabolic acidosis. Hepatic encephalopathy, D, presents with altered mental status due to liver failure. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A, administer lorazepam immediately. Option B, provide reassurance and remain calm. Option C, place the patient in seclusion. Option D, encourage deep breathing and mindfulness. The correct answer is option B, provide reassurance and remain calm. A calm, reassuring presence is the first-line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to escalate the situation. While lorazepam, A, may be used for severe cases, it is not first-line. Seclusion, C, may increase anxiety. Deep breathing, D, is helpful but the nurse's calm presence is the initial priority. Question 20. A patient has a Glasgow Coma Scale, GCS, score of 7. What does this indicate? Option A. The patient is neurologically intact. Option B. The patient has a moderate brain injury. Option C. The patient has a severe brain injury. Option D. The patient is brain dead. The correct answer is option C. The patient has a severe brain injury. GCS scores are interpreted as 13-15 mild brain injury, 9-12 moderate brain injury, and 3-8 severe brain injury. A score of 7 indicates severe brain injury requiring intubation and ICU care. This patient is not intact, A, does not have moderate injury, B, and is not brain dead, D. Question 21. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 22. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option A, systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 23. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 24. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with POW2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG POW2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific. Question 25. A patient presents with heat stroke. What is the priority nursing intervention? Option A, administer antipyretics. Option B, rapid cooling with cold water immersion. Option C, administer 4 fluids. Option D, obtain a core temperature. The correct answer is option B, rapid cooling with cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. Cold water immersion is the most effective method. Antipyretics, A, are not effective for heat stroke, as the elevated temperature is from environmental exposure, not a reset hypothalamic set point. 4 fluids, C, are important but cooling is the priority. Obtaining core temperature, D, is important but should not delay cooling.